Our goal is to make sure we develop relationships with all the stakeholders. Right now, we have a wonderful relationship between Independence, Blue Cross, and Jefferson in a collaboration that will truly improve the quality of life of our patients.
And one of the issues that faces us today, which I would consider as the most important problem, is infection.
Prostheses have one function, they provide mobility, but they at times get infected. So what do we do today? Today we make sure patients are immunologically competent. We make sure we give antibiotics before the surgery. We make sure we give antibiotics after the surgery. But now science is evolving.
We put on the surface of the implant something that's called a self-assembled monolayer. And what this is it's a coating of different molecules that lock together. And so they form a surface, but they're only one molecule thick. And they are bonded to the existing implant, so that rather than being a surface like if you spread oil over something, this is actually something that's going to stay there during most normal uses.
We did have a period when there was a large amount of interest in this. We were funded by the National Institutes of Health. We were funded by the Department of Defense. We were funded by the Grayson Foundation. So we had a considerable interest in the implants that we were generating.
Now the competition is fierce, the federal funding has shrunk. So the fact that we've struck this relationship and we're able to come together
provides an enormous stimulus to our work. We can now move these basic studies forwards and start visualizing, start generating implants and bone grafts that can be used on patients.
No, it's a great opportunity. This program from Independence, Jefferson, and the EIR program, I think, for me, I was really impressed by it. And I was most impressed that an insurance company wants to also do research and give back to the patient care. It's a very interesting time. We have the opportunity to help patients with epilepsy. Once we figure out where the seizures are coming from, we can either take a laser and remove that tissue, we can open the skull, remove the tissue, we can put pacemakers to change the way it is. So we have many tools now that weren't there even 2 years ago. The tool that we don't have yet is a way to take the information from hundreds of patients, put them on a single platform to try to make a decision when the next patient comes in. So I think with this award, the EIR award, we hope that that is exactly what we'll develop, a platform that will be able to not only make life better for epilepsy patients, help us understand the disease, map the entire human brain.
I think the most important aspect of the Entrepreneurs in Residence program is to bring together of a health system and an insurance company in a very unique relationship.
And saying we're both putting our money, our time, our resources, our people together is really just not only a great thing for Independence and Jefferson, but a fantastic thing for Philadelphia.
So we're bringing the best minds, starting with Steve Klasko and the team at Jefferson, with the team that we have here at Independence to say, how can we continue to put every Jefferson patient, every Independence member at the center of everything we do. Innovation's the way to do it. So we're excited to be Jefferson's partner in that area.
And what we're able to do in this partnership is to bring clinicians who are experienced in these fields of care, notably epilepsy and orthopedics, to address problems that are ongoing. And this is really part of what we're talking about when we talk about reimagining healthcare.
Innovation matters at Independence because it's what's going to get us to the next century, the next era of competition, of customer service, of where healthcare is going. Those are all elements today that exist that really don't take into consideration the customer. So we've got to figure out ways that we can engage that customer. I know that's used a lot, but it really does mean something. And get the customer in a way that they feel just as educated about what happens in healthcare as they do about what happens in the electronics store.
I want to wish everybody a great time tonight at the Bacon Brothers concert. We're really pleased to welcome them back to Philadelphia. I hope you all enjoy the night and rock, rock, rock on!